active COVID cases have surged to over 1,000 cases. The death toll in the current wave has also jumped to 13, but authorities have told people not to panic. Most of the surge in cases has taken place in Delhi, Maharashtra and Kerala, being worst affected, clocking 74% of the newly reported cases. The spread is due to two new COVID variants, which is NB1.A.1 and LF.7, both being subvariants of Omicron. Both variants have high transmissibility, but there is no significant spike in hospitalizations and case severity. So let's open up this discussion. Dr. Sanjeev Bagai on the telecast with me. Dr. Bagai, the cases, do you think it's alarming that the death toll has risen to 13 in just about a few days? Should we be fearful that this number could rise dramatically in the coming days?
Good evening. First off, of course, these are all the sub-lineages, sub-strains of Omicron. What we are seeing is three prevalent substrains amongst about 1,800 Omicron sub-lineages. The parent one being BA.2.86, which became JN.1. So we are seeing JN.1. And JN.1 has then further subdivided into LF7 and LP8.1. So these are the two breakaways of JN.1. Overall, all these three strains have particular characteristics. So they have a unique set of mutations. They have 69 in all, out of which 19 mutations are unique, but they have lost as a trade-off 24 important mutations. So in this phase of evolution of this sublineages, what has happened is that it has become more transmissible. That means person-to-person contact, the infection can transmit more. That is because of a flip mutation at LS455 position, but it has become less RBD and binding to the ACE receptor. That means it latches on to your throat and lungs lesser. That means it is less infective, less lethal. So clearly the message is not to worry. There is no need to panic. We are not going to see the surge like in Delta, which is the second wave in Delhi NCR in northern India. We are not going to see that kind of surge of hospitalizations and death. We have had, out of a population of 1.4 billion plus, we vaccinated 2.2 billion, that's 220 crores. We have developed a level of immunity in the community as such. This symptom is milder. You will have cold, cough, fever for 3 to 4 days. The differentiation factor is severe fatigue. So don't self-medicate. Only paracetamol is good enough. There is no antiviral treatment required for this. There is no repeat vaccinations, no repeat boosters, no antibiotics, no hospitalizations. Consult your doctor. If you have symptoms, the doctor will guide you further. If at all you need an RT-PCR.
Dr. Rao, again, my same question. The death toll has increased to 12. This is going to create a sense of concern and panic amongst people. What is it that you would suggest?
I would suggest the same. Don't panic. See, any virus, any new virus which comes into existence or starts attacking human beings, eventually it evolves. It evolves to a condition where it kills less, because if it kills all the hosts, then its own existence comes into question. So all viruses, even if they are very deadly in the beginning, they slowly keep mutating till they become easily transmissible. Means they spread easier. The mutational forms which spread faster, easier survive, and which don't kill the host. And what we are seeing different now is that this is tending to spread even in summer, not only in winter, where normally all these airborne infections are more. It is spreading in summer. It is causing a lot more body pain and ache, like Dr. Bagai said, and which is due to a better immune reaction by our body. It is the immune reaction which releases inflammatory agents which cause the body to have severe pain. But at the same time, the number of deaths or problems will be far less with these variants. So there is less to worry. And the people who have not had exposure to the coronavirus, these are the people who are born in the last 5 years, people who were children in the last 5 years whom we didn't vaccinate, they may have a lower immunity. And of course, all those who have comorbid conditions or who are on chemotherapy for cancer, for various other such problems, they will have lower immunity. And
Okay.
the advice is the same as for any airborne infection. Please use N95 mask, social distancing, hand hygiene, and avoid crowded places.
Dr. Chinmay Gupta, what should the key precautions be? Okay, I'm being told Dr. Chinmay Gupta still not joined me, but I have with me Sahil Malik. Sahil Malik, again a question from you with regards to what are the kind of queries that people are coming to you with, whether it is about themselves, if they have suffered any of the symptoms, what are the kind of symptoms that they have been suffering, how long is this entire bout, if they contract the disease, is going to last, and again, if there are deaths being reported, which clearly reflects to the point that it is not it is important to take this spread that is currently being transmitted in different parts of the country in a serious fashion.
Right. So basically, because of the change of season that is also there, people are getting upper respiratory tract infections and basically what is known as common cold and sore throat and everything. And they might think that it is COVID or it's not COVID. So we usually get such kind of basically queries that are coming not only directly to us, but through our call centers also. Do we have to do it? Where to get the testing done? Do we have enough number of beds? So as per government orders, the hospitals are getting prepared and most of us know the drill itself. So we are prepared. We have made isolation beds and everything. So again, people should not panic in this aspect because they keep on hearing of the increased number of cases and then also subsequently deaths. So they keep on getting worried in this aspect. But the key point to remember is these deaths that are coming in are only in comorbid patients. That means they have some or the other risk factor associated. And people must understand what are the risk factors associated. So anyone who is above 65 years or less than 12 years, that is clear cut. Any pregnant people, any people that are actually immunosuppressed, that is, they're having active chemotherapy, cancer patients, and then might be taking steroids for any other ailment, and any people who have comorbidities like diabetes, hypertension, who smoke or have chronic lung diseases like ILD or COPD or asthma. So they should be more careful. So we usually have such kind of queries and these problems. And it is expected that the number might increase, but as the doctor earlier on also said, this is a mild variant, and what we are seeing right now is that the transmission is not very rampant altogether. People are aware. The only thing is that they should start using all the health norms and regulations that were there, like wearing a mask and social distancing and maintaining hand hygiene. That's the most important thing, that message that we need to give out.
I have with me Dr. Chinmay Gupta now. Thank you for joining us, Dr. Gupta. And my first question to you, what is the approximate duration of the bout if an individual contracts the disease?
Hello, I'm Dr. Chinmay Gupta. I am a cardiologist in Apollo Hospital in Indo-European Healthcare. So, as we are all seeing that COVID-19, the cases are increasing in India and the world. So, the duration, like you asked, the duration of a disease is around like 7 days to 10 days. In previous, this is a new strain. You see, this is a LF7 NB 1.8.1 strain, which has come up again. And I think this is the fourth wave which we are seeing in the last 3, 4, 5 years. So I just want to tell the public that we should be like, you see, prevention is always better than cure. So I think as Dr. Saab has said that we should all be like very cautious, like in going to public places, and we should all wear mask and do social distancing. So we should all start doing this, and we should also look forward that this should that the total number of cases do not rise, and because you see, one bad thing about this strain is the infectivity rate is more than the previous strains, and one good thing is that this is causing like mild symptoms, not very serious symptoms have come up in most of the people, but those individuals who have like predisposition to any lung disease, any hypertension, diabetes, or any heart disease, they be really like extra careful, and we should all help in preventing this disease.
Okay. Dr. Bagai, then do you think it will be necessary for the government and authorities and administrations to, I don't know, restrict individuals to step out in large numbers in public places, at airports, at railway stations, at shopping malls, on the streets?
Yeah, so I don't think we are anywhere close to any government regulations as far as restriction of movement is concerned. I don't think we are anywhere close to having any formal or informal lockdown. I think simple public messaging at the present moment should be more than sufficient. What is important is that even though it is more transmittable from one person to another person, it is not the virus which causes not the ones which cause lung infections, pneumonias, hypoxia, respiratory distress, and because the mutation in this particular GN1 and its two sublineages is not binding on to your ACE receptors in your lungs as much as the previous variants. So the only precaution we need to take is self-precaution, especially with the summer break now started, and we know that we are going to have summer holidays. People will be traveling, there will be clusters in airports, in flights, and in tourist resorts. So we just need to keep simple precautions from that point of view. At the present moment, there is no need for any revaccination. At the present moment, there is no need for any boosters. I must add that this particular strain of GN.1 and indeed LF and LP8.1 are the most immune evasive. That means your previous vaccines which we use as Covishield and Covaxin will not be as effective right now. Having said that, there are bivalent vaccines available abroad, but we have not reached that stage. Simple precautions, no panic. The message really is public education, public awareness all over again, like what we did in the last 3 or 4 years.
Okay. Dr. Rao, I was going to ask the same question, and Dr. Bagai said that there is no need for revaccination. But then, do we have enough vaccines in our hospitals and clinics for those who, for some reason or the other, were not vaccinated during COVID-19 that struck the world?
Yeah, Mega, the vaccines are available. What our state government is doing is it is supplying large numbers of testing kits so that we increase the surveillance and we increase the testing, which we haven't been doing much in the years in between, because it looked as if the COVID had settled down into a very low level of endemic virus, what we call as an endemic virus, which survives but doesn't is not causing large number of infections. And now then there is increasing awareness that COVID-19 infections are on a surge. The testing is being increased, the vaccines are available, but like Dr. Bagai mentioned, we need to update the vaccine, for which the vaccine manufacturers have to be supplied the present spreading virus. So samples are being taken and being sent to the two manufacturers to help them update their vaccine so that it is more effective against the present strain. So the present strain has to be supplied to them, and that is what is being done. Samples are being taken, identified, tested, and then once the strain is known, it is being supplied to them so that they can update the vaccine. Yes, Megha.
Dr. Salil Mali, coming back to you about the symptoms that are most commonly being experienced by patients is sore throat, body ache, lethargy. Could you enumerate for us what are the correctives that patients can do, can take so that they are not encumbered by this strain of virus?
Yes, very right. So the main symptoms are of upper respiratory tract, namely running nose, lethargy, and then sore throat and dry cough also. So the precautions in this aspect that they can take is make sure that they get themselves tested, and if tested positive, make sure they are in isolation. Moreover, whenever such kind of symptoms start, so they do not use their hand or any repeated handkerchief to make sure that they are spreading the virus here and there, irrespective whether it is COVID or any other upper respiratory tract infection. So they should be using tissues and making sure that they are wearing a mask. Then there were small precautions like if they don't have a mask and they are having a sneeze, so they should try to use the elbow per se to sneeze into that or cover their mouth per se. Try not to go unwantedly into large gatherings. Try to make sure that nowadays we have such a robust e-business, so try to get the things to your home rather than going out too much. That is definitely one thing that you can do. Try to maintain as much of social distancing. I think so. As people will start using masks, people will keep on looking at each other, and inadvertently, they will also have a tendency to start using masks per se.
Okay, Dr. Chinmay Gupta, I have another concern over here about children, and thankfully it is going to be the holiday season, the summer holiday season very soon. But how can precautions be taken in the school premises, where children tend to be more careless than adults?
Can you repeat the question, please?
How can school authorities, staff, teachers ensure that children in the school premises are safe?
Oh, that is a very important question. I think the school authority should, if you see the children in pre-nursery, nursery, KG group, if any of the children are having any of the symptoms of upper respiratory tract, like any kind of fever or running nose or any cough, cold, anything, I think that should be informed to the parents, and I think they should be tested with RT-PCR testing or rapid antigen, and then they should go into isolation. They should not come to the school so that the other children are not exposed to that virus.
Okay. All right. On that note, I thank all my doctors who have joined me and shared all their inputs to make people more aware and to not set them in panic mode in wake of these reports that are trickling in of increased number of COVID cases that are being reported from different parts of the country. We are now being joined by the Health Minister of Delhi, Mr. Pankaj Singh. Thank you for joining us. And my first question to you about the current situation in Delhi. Delhi is amongst the states which have a large number of COVID cases being reported.
देखिए, पहले मैं आपके चैनल के माध्यम से बस स्पष्ट कहना चाहूँगा कि कोरोना दिल्ली में कहीं भी कोई पैनिक की जगह नहीं है। कुछ केसेस पाए गए थे, उसमें हम चेक भी कर रहे हैं कि वो दिल्ली के में बाहर से आए थे कि दिल्ली के थे, और जो केसेस पाए गए वो एब्सोल्युटली नॉर्मल है, वायरल बुखार की तरह हो रहा है, सब कुछ ऐसा नहीं है। दिल्ली एब्सोल्युटली इस चीज़ से फ्री है, इसमें यहाँ ना कोई कैजुअलिटी है, ना कोई एडमिशन्स होती है। एक आध लोग हुए, वो आराम ठीक हो गए, अपने घर चले गए। कोरोना की ऐसा कोई विषय नहीं है जिसके लिए दिल्ली की जनता को कहीं बारे में सोचना चाहिए, और ना कोई कोरोना का ऐसा कोई विषय है।
आपको गवर्नमेंट को, हेल्थ मिनिस्ट्री को क्या फीडबैक मिल रहा है डॉक्टर्स द्वारा, हॉस्पिटल्स द्वारा? ये जो सिम्टम्स उभर कर आ रहे हैं, जो न्यूएस्ट कोविड का स्ट्रेन विच इज स्प्रेडिंग वेरी फास्ट।
सर नॉर्मल जैसे वायरल के सिम्टम्स होते हैं, सर्दी, बुखार, खांसी, और इसको आप एक वायरल का ही पार्ट समझिए। मेरा व्यक्तिगत मानना है ये वायरल का ही पार्ट जैसा पार्ट है। इसमें कोई भी लक्षण ऐसे नहीं है जो अनयूजुअल आपको देखने को मिले। ये सिर्फ एक मौसम का, हालात का बदलने की तरीका है, और मुझे लगता है कि अगले 3-4 दिन में ऐसी कोई चीज़ भी देखने को।
What precautions, आपको क्या लगता है किस तरह के प्रिकॉशंस, सावधानी बरतनी चाहिए दिल्ली के लोगों को, ताकि उनके फैमिली मेंबर्स, उनकी सोसाइटी में लोगों को कोविड कॉन्ट्रैक्ट ना हो?
दिल्ली में ऐसा कुछ है ही नहीं है कि सावधानी बरती जाए। दिल्ली अपने नॉर्मल गति पे रहे। दिल्ली में ऐसा कुछ है नहीं कि जिसके लिए सावधानी बरतनी है। कोई भी कैजुअलिटी की बात जहाँ तक आती है, उसमें हम लोग कोरोना कह रहे हैं। कैजुअलिटी मतलब कैजुअलिटी, एनी कैजुअलिटी, वो कोई फीवर भी हो सकता है, कार्डियक अरेस्ट भी हो सकता है, कुछ भी हो सकता है। उसके लिए हमारे हॉस्पिटल सब तैयार हैं। कैजुअलिटी के लिए, किसी कैजुअलिटी के लिए भी तैयार है। कोरोना के ऊपर कुछ भी ऐसा नहीं है जिसके लिए आपको बताया जाए कि कोरोना से
जो आप प्रेपरेशंस दो दिल्ली की गवर्नमेंट कर रही है, दिल्ली की हेल्थ मिनिस्ट्री कर रही है, कितने कोविड आइसोलेशन बेड्स इस समय दिल्ली में उपलब्ध हैं, और कितने ऑक्सीजन, इज देयर इनफ ऑक्सीजन अवेलेबल इन द हॉस्पिटल्स टू प्रिपेयर फॉर द वर्स्ट?
100% है। हमने पहले भी आपको बताया था कि उसकी एडवाइजरी हमने जस्ट फॉर द प्रिकॉशंस जारी की थी। 100% हॉस्पिटल, हमारे हॉस्पिटल, आप कोरोना की बात करिए, मैं कैजुअलिटी की बात करता हूँ। कोई भी कैजुअलिटी के लिए, कैजुअलिटी में कुछ भी हो, चाहे पेशेंट बीमार होके आए, चाहे पेशेंट एक्सीडेंट में आए, चाहे पेशेंट कार्डियक प्रॉब्लम में है, किसी चीज़ में भी है, हमारे हर दिल्ली गवर्नमेंट के हॉस्पिटल हर चीज़ के लिए इक्विप्ड है। हमारे डॉक्टर्स इक्विप्ड हैं। हमारे को किसी चीज़ की कोई परेशानी नहीं है, और कोरोना से घबराने का कहीं भी कोई विषय है ही नहीं। मैं आपको इंश्योर करूंगा, जैसे कोरोना का मूवमेंट चल रहा है, 3-4 दिन बाद वो आपको दिखेगा भी नहीं, क्योंकि ऐसा कुछ है नहीं जो आपको बताया जा सके। कोई एबनॉर्मेलिटी कुछ ऐसी नहीं है। जो पेशेंट है वो सर्दी खांसी की तरह होके अपने घर गए।
आपके असेसमेंट में आपको क्या लगता है कि जो करंट केसेस हैं, क्या ये 200 से ज़्यादा जो केसेस दिल्ली में रिपोर्ट किए गए हैं, क्या ये दिल्ली की पीक है कि इससे ज़्यादा बढ़ सकते हैं, कि क्या नंबर्स अब नीचे जाएंगे?
मेरे अनुसार अपने चरम पे है। अब उसका ख़त्म होने का समय आ चुका है।
ओमिक्रॉन जो वायरस है वो इतना सिवियर नहीं है एज हमने देखा। जब डेल्टा वायरस जब स्प्रेड हुआ था दिल्ली में, उसमें काफ़ी डेथ्स रिपोर्ट हुई थी, काफ़ी लोगों को हॉस्पिटल में एडमिट करना पड़ गया था। हॉस्पिटल्स में जगह नहीं थी, बेड्स की कमी थी, ऑक्सीजन की कमी थी। क्या प्रेपरेशंस इस समय हैं दिल्ली हेल्थ मिनिस्ट्री द्वारा की गई हॉस्पिटल्स के अंदर, ताकि ऐसा कुछ देखने को ना मिले जब डेल्टा वेव स्प्रेड हुआ था दिल्ली में?
मैडम, ओमिक्रॉन और डेल्टा को प्लीज समझने की कोशिश कीजिए। फैलता है, इज देयर एनी आइडेंटिफिकेशन, कहीं लिखा हुआ है? ये आपको बताया वायरल भी फैलता है। अगर किसी को सर्दी, खांसी, बुखार, जुकाम हो गया, वो भी तो किसी न किसी को, अगर आपके बगल में बैठे आदमी को जुकाम होता है तो उसको जुकाम हो जाता है। ऐसा कुछ नहीं है। मैं आपके चैनल के माध्यम से बड़ा स्पष्ट एज ए हेल्थ मिनिस्टर बताता हूँ कि दिल्ली में ऐसा कुछ भी, कोई भी समस्या की कहीं भी कोई कुछ आवश्यकता नहीं है। सब कुछ अपनी यथास्थिति पे है, और इसमें घबराने की कहीं भी कोई विषय नहीं।
All right, Pankaj Singh ji, thank you very much for joining us and giving us all those updates.